No further cases have been identified in staff or patients, which is good news. It is not unexpected at this time of year that we start seeing increases in our winter viruses, that being norovirus, seasonal flu, COVID. We are fully expecting the number of COVID cases, for example, to increase again. Now, that may not be resulted us having to change our advice. What we'll be doing is watching closely in terms of how many hospitalisations we have. And that's why I'd really encourage people when they are contacted to have either a seasonal flu vaccine or a COVID vaccine to take up that offer.
And why do we see an increase in these viruses at this time of year?
These viruses are very infectious. And this is why norovirus especially, once you have somebody vomiting, the virus can be aerosolized into the environment. So they spread very rapidly. And this is why we're encouraging people, if you have symptoms of diarrhea, vomiting, heavy cold, even if you test negative for COVID, please do not come and visit your loved ones at the hospital or at ERS.
What lessons have been learned in terms of infection control following the pandemic, both at the hospital and more widely in the community?
I think we have seen greater awareness of the public in terms of symptoms and the need to wash your hands. In terms of the hospital learning, we are very rapidly identifying outbreaks at the hospital. We're rapidly initiating testing to make sure that we understand what the virus is. And as per our policy, which unfortunately has been practiced a lot over the last couple of years, initiating our control measures. These being, for example, limiting staff movement between wards, enhanced cleaning and restrictions on visiting that I am fully aware families and relatives find very frustrating when we cease visiting. This enables us to rapidly get on top of an outbreak and prevent that onward transmission.
You've highlighted COVID and seasonal flu, with vaccines currently being offered to those at risk. How is this programme being rolled out?
So we launched our programme yesterday, and the difference is this time we are initially offering not to the whole population but to those who are most at risk, these being people who have long-term conditions or live with people who are immunosuppressed, for example. So we were able to vaccinate about 70 people yesterday, and our advice is if you get phoned and contacted and invited in to come and have your vaccine, please take up that offer.
And will these be offered more widely to the community?
Not at the moment. We have ordered vaccines to cover just the at-risk groups at this time. If we have vaccine stocks left over, when we've done those, we'll take it into consideration. Operationally, can we deliver those and offer those to the wider population? But at the moment, no, it is just the vulnerable at-risk groups.
Will the AstraZeneca vaccine also be offered?
We won't be offering the AstraZeneca one at this time, and the reason for that is we don't have access to one that covers the new strain. So the vaccines that we're offering, the Moderna vaccine and the Pfizer vaccine, offer both the old strain and cover for the Omicron strain.